Good evening. Tonight we have the privilege and honor to present an award to Doctors Jerry Cohen and Rick Dutton. To Dr. Dutton, we are recognizing the continued merits of the Anesthesia Quality Institute's work to develop an evidence-based clinical standard of care and improved outcomes. To Dr. Cohen and the American Society of Anesthesiology for supporting ISOBIS's mission of improving safety in the office-based setting.
Tonight, we highlight the patient experience, how patients can participate in the process to ensure their own safety.
This year, through Harvard Medical School, we performed our first pilot study. In a plastic surgery office with a pre-existing high standard of care, we performed a chart review of 219 cases pre- and post-implementation. We evaluated baseline and post-operative complications and adverse outcomes. Our results: the total number of complications was 15.1 out of 100 patients. Post-implementation of the checklist, the number decreased to 4.8 of 100 patients. This was an absolute risk reduction of 10.3. These results were similar to those found by Dr. Gawande and his colleagues in the hospital setting, published in the New England Journal of Medicine in 2010. Our latest initiative is the patient checklist, which we call ISOBIS PC. These are questions patients should ask prior to undergoing an office-based procedure. We thought it timely to begin our recognition of tonight's honorees, where the first demonstration of anesthesia took place, October 16, 1846, in the Ether Dome at the Massachusetts General Hospital. 162 years later, October 12, 2012, I would like to introduce Dr. Lucy Everett.
Greetings from the Ether Dome at Mass General Hospital. I'm Lucy Everett, and as a past president of SAMBA, it's my pleasure to add my congratulations to Rick Dutton and Jerry Cohen for their efforts on behalf of patient safety. I've watched ASA move forward on the AQI project for a number of years, and the leadership, including Dr. Cohen, have been critical to moving that mission forward. Rick Dutton came on board with all the enthusiasm and leadership skills that it took to really implement the project. He understands the importance of registry research and has been tireless in reaching out to the subspecialties to collaborate. Going forward, this should improve patient safety and cut cost and allow us to really develop evidence-based guidelines. We hope at SAMBA to be able to continue our collaboration not only with AQI, but with ISOBIS in integrating their patient safety checklist into the SCORE framework. Again, it's my pleasure to congratulate Dr. Cohen and Dr. Dutton for their achievements.
I'm Alex Hannenberg, 2010 ASA President, and I'm grateful to ISOBIS for the opportunity to recognize two exceptional contributors to the cause of safety in office surgery, whom I have the pleasure to call friends. Dr. Jerry Cohen, 2012 ASA President, and Dr. Rick Dutton, Anesthesia Quality Institute Executive Director. Throughout his career as a board member and as an officer, Jerry Cohen has been a stalwart booster of safety initiatives. And as a Floridian, he is more aware than most of the need to elevate the standard of care in the office setting. Indeed, his background includes service to the state of Florida as an expert in holding cosmetic offices accountable. And he has given much blood, sweat, and tears trying to focus the Joint Commission on genuine perioperative safety issues. Rick Dutton is leading what I predict will be the leading anesthesia quality and safety effort of our generation, our National Anesthesia Clinical Outcomes Registry and the Anesthesia Incident Reporting System. NACOR will ultimately help us identify the circumstances in which our patients get into trouble and allow us to craft strategies to avoid it. Acquisition of outcome data from large and small practices in hospitals, clinics, ASCs, and offices will highlight best practices in all settings. Rick has developed strong partnerships with related registries, notably SAMBA's SCORE project, which has a natural synergy with the work of ISOBIS. As cost of care pressures intensify, the need to assure safety in all settings of care becomes increasingly critical. I congratulate Jerry, Rick, and all the leaders of ISOBIS for their contributions to this effort.
Well, it's been a privilege to serve with Dr. Jerry Cohen this past year, with him as the president and me serving as the president-elect. Jerry brings a great combination of academic preeminence as well as a tremendous amount of leadership and political savvy about him. And he's been a guy that's been able to really put all that together in the interest of the American Society of Anesthesiologists and really in the interest of the many different specialties and things that we have out there. I know that ISOBIS is obviously very interested and focused on the office-based arena in terms of the delivery of safe anesthesia care. And Jerry has likewise made that a very, very prominent part of his presidency. It is one of those last perhaps frontiers, if you will, in terms of bringing safety to anesthesia, and ISOBIS has been really a leader in that. Jerry's been a remarkable leader for the American Society of Anesthesiologists, and very specifically, he's been a great advocate for bringing very high quality, safe, office-based anesthesia.
We are privileged to honor Drs. Jerry Cohen and Rick Dutton, and we congratulate them on their accomplishments and their support of ISOBIS's Patient Safety Initiative. We now turn our attention to the patient experience, activating patients toward ensuring their own safety.
Thanks to Fred Shapiro and Richard Ehrman's leadership, ISOBIS continues to develop new tools for patient safety for office-based procedures. To its great credit, ISOBIS has developed the Patient Safety Checklist, which was based on the Safe Surgery Project led by Atul Gawande. Through research, publications, and publicity, the checklist is beginning to gain momentum. It's time to move on to the next phase, to engage patients, to engage all of us in our own patient safety and office-based procedures. The ISOBIS Patient Checklist, the ISOBIS PC, is a great step in that direction.
I'm Lucian Leap. I've been working on patient safety for a long time. I was a member of the Institute of Medicine committee that published To Err is Human. One of the key lessons of patient safety has been to change our systems to prevent mistakes. ISOBS has developed an effective and simple method for doing that. It's called a checklist and is now being distributed and used in offices all over the country. The new development is a checklist for patients, and I encourage you and your patients to use it wherever possible. It's a way for patients to become true partners in their care and to help all of us minimize mistakes in everything we do. Thank you.
To echo Dr. Lucian Leap, we share a true story of a young woman, Julie Rubenzer, who died while undergoing an office-based cosmetic surgery procedure. Question: would these course of events have been different had Julie had the patient safety checklist? Here's what Julie's father has to say.
My name is Don Hare. My wife Maureen and I live near Milwaukee. Our daughter, Julie Rubenzer, age 38, lived in Sarasota. She walked into the cosmetic surgery center and she didn't walk out. The medical people involved all surmised that she was overdosed with anesthesia. A nurse slipped us a secret tip. She wrote on a note, "Look for Demerol or Propofol." The doctor did not have hospital privileges. The doctor was certified as a plastic surgeon by an organization that was called the Florida Board of Plastic Surgeons. The doctor was not insured for medical malpractice. The surgery team was Dr. Kurt Dangle, surgeon, a registered nurse and surgical technician. The anesthesia was ordered by the doctor and delivered by the registered nurse. A few minutes into the surgery, the nurse sounded an alarm that the patient stopped breathing and they had no pulse. They alerted the doctor to do CPR. The doctor said, quote, "Not yet," and he continued the surgery. Between 2 and 4 more minutes went by, and Crow yelled at the doctor that, quote, "We must do chest compressions. Her fingertips are turning blue. Her lips are turning blue." Crow did repetitions of chest compressions. She started breathing. They got a pulse, and after a time was breathing normally. They placed a 911 call to the city rescue squad. They arrived, and the doctor made them stay in the waiting room. A second rescue team arrived a few minutes later, which did indeed transport Julie to Doctors Hospital. Now, the anesthesia cocktail included a dose of 1,650 milligrams of propofol. In 2007, I started to realize that this story should be told and read. I titled the book, The Who's Next Club, A Cosmetic Surgery Disaster. My intent was and is to use this story to try to make something good come out of something very bad, and maybe cut the death rate. Then I was introduced to Dr. Shapiro and his Institute for Safety in the Office-Based Setting. There are certain questions that patients should have answered, such as certifications, med-mal, insurance, hospital privileges, rescue, anesthesia, delivery, and more. But in the real world, most patients are reluctant to ask. Most assume that the framed diplomas on the wall are a guaranteed safe atmosphere. But there is a way. If those questions were placed in a pre-op form, along with the other forms to be signed, the patient should have the answers. So I think that the ISOBS patient safety checklist would do just that, which in turn would reduce the death rate. And last, I want to thank Dr. Jerry Cohen and the leadership in the ASA for your interest in this disaster.
Hi, I'm Atul Gawande. I'm a surgeon at Brigham and Women's Hospital and a professor at the Harvard School of Public Health. And I'm a supporter of what ISOBS is trying to do. Bring the kinds of safety that we have begun to achieve in operating rooms and make sure those same standards apply when surgeons are doing office-based surgery. This couldn't be a more important mission at a time when office surgery is exploding. They are carrying out this work in ways that are introducing standards and protocols that could genuinely change care. I'm grateful for all of their work, and I'm grateful to all of you for supporting it. Thank you.
Tonight, we recognize Drs. Jerry Cohen and Rick Dutton's accomplishment. Through Dr. Dutton's leadership at the Anesthesia Quality Institute and Dr. Cohen's leadership at the American Society of Anesthesiology, their support has inspired our continued efforts to improve patient safety in the office-based setting.